Hi, Dr. John with Pro Chiropractic, and today we're doing another video that shows some of our treatment procedures here at Pro Chiropractic, and we're talking specifically about iliotibial band friction syndrome, also just called IT band syndrome. A lot of people know it as runner's leg as well. You get a tightening in the band on the side of the leg, pain right on the outside of the knee, especially when you run downhill. So some of the procedures we do. Number one, we're going to do a functional test to see if the knee's in proper alignment. Very important. And then we get to some soft tissue work. So what we have the patient do is bend the knee, turn the foot in, lock it there, and don't let me turn out. She's rock solid there. That's exactly what we want to see. Then the other side, up and in, hold there, don't let me turn. Again, don't let me turn. And see how she gives away there. Typically that means that the shin bone, the tibia, has moved posteriorly, moved backwards. Often they'll be tender right back in the back part of the knee, and she is a little bit, so we do an adjustment here to bring that forward. There we go. And a little bit to take the rotation out. There we go. Good. Sometimes that smarts a bit. Hold right there. And don't let me turn, okay? Lock. Good. Better. All right. Go ahead and roll on your side, facing that way for me, Sabrina. All right. After we have it aligned, we want to release some of the tension in the IT band itself. So, use a little bit of emollient to reduce the friction on the skin surface. Use our Graston instrument. This is an instrument that helps release the adhesions in the soft tissue all the way down the IT band from the hip, clear down into the knee. Now if you have this problem, this procedure is probably going to be tender. How does that feel?
Fine.
Okay, good. Alright, and it doesn't take too long to see a pretty good response right in there. Definitely a reddening in the area, and that's very normal. Now there's a couple different instruments we can use depending on how deep we want to get in there. You'll see this one has a convex surface instead of a concave surface, and so you can feel it a little bit more in there. And then we would work right around the outside of the knee, right where that IT band attaches and causes the pain. Now for somebody with the even more severe case, maybe a football player or someone with a lot more mass in the leg, we also have this instrument called the handlebars where we can get in even more, but we're having just a textbook response right there. This is really great. The first time or two that we do this procedure, it's going to be more tender. Okay, there are going to be some areas that downright hurt, but the more we do it, the better that it feels. And then finally, it's important to have something that helps the swelling and inflammation when the patient is not in our office, and that's where Kinesio Taping comes in. So for an IT band, what we want to do is go along the entire length of the IT band, anchor our tape on, put a stretch into the band, right into the outside of the knee. And then depending on where the majority of the pain is, we can do a correction strip on that as well. So we'll say she was hurting right in this area here. Again, we're going to put a stretch into that IT band. If you notice, I'm just putting light tension into the tape. Somewhere around 20%, and then no tension on the ends. Heat activates the adhesive in the tape, and the tape will stick real easy and stay on for quite a long time. So there you go. The treatment that we do at Pro Chiropractic for runner's leg. Okay, a combination of making sure the alignment is proper, making sure the soft tissues are released, and the Kinesio taping is on there to promote the healing, to create space. If you want to learn more about any of these procedures, watch more videos, log on to our website at prochiromt.com or just click the links below. Thanks.